we've looked at a couple of different exercises trying to rebuild the muscle development of the leg. So we've looked at leg bracing to give our patient the opportunity to tighten their thigh muscles. And then we looked at our short range quadriceps exercises where we extended the knee over a block. And then we looked at our normal leg extension where we said that the aim was to get the quadriceps to strengthen, but make sure that they get that full extension and avoiding any extensor lag. So all of those movements work on the whole, the quadriceps muscles in isolation. You'll get a little bit of hamstring work, but mostly it's going to be 90% quadriceps. Now, of course, in daily living, both the quadriceps and the hamstring muscles work together, and the knee joint and the hip joint works together. So we now need to mimic that. So we're going to move from non-weight bearing exercises to mimicking a partial weight bearing exercise. We're not actually going to take weight, but we're forming a closed kinetic chain by pressing against something. So we're going to start off transferring our weight bag, which is our resistance that we used for our leg extension, to using a resistance band. Now these resistance bands are very low cost and they're excellent. The only thing is the safety consideration would be that normally within a clinic environment your patient should wear safety goggles just in case the band either snaps or releases and flicks, and when they're at home they should be encouraged to use safety goggles. If they haven't got those, then just get them to turn their head away from the movement once they start to perform the action. So Lisa's going to hook this around her foot, and then she's going to take hold of that, and we're going to lie her down flat. So again, she's not looking directly at the movement. And then I don't want this to slip, so she's going to wind it several times around each hand. Okay, so the action is to initially start by drawing the knee up. So she's moving from a 90-degree action and she's pushing out against the resistance of the band. So just press and straighten that leg, and then come back and bend, and then push and straighten. And we start off with whatever resistance is useful for them. And to start with, it's not so much a strength exercise as a coordination exercise, as getting somebody to work both sets of muscles. And ultimately we'll move on to that as a leg extension movement in the studio. All right, so you notice that Lisa's turned her head away from the belt, just to make sure that if that slips, she's not going to have problems with the eye. All right, so let's now move on.